The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Bodily autonomy, as you pointed out, it's our basic unit of liberty. I honestly, unfortunately, believe we live in a country that we could not have founded because we do not believe we have bodily autonomy. If we did, on September 9th, 2021, when Joe Biden threatened us all with our patience is wearing thin, stated the obvious, that this is not about freedom or personal choice, declared the vaccines to be safe, and described a pandemic of the unvaccinated, he wouldn't have been in office in the next day. But he was. And on your point of humility of the situation, I think that is the perfect word, because the then Secretary of HHS could have changed history with one word. He could have summoned the greatest army of statisticians and mathematicians and data scientists ever assembled under one topic with one word. That word was help. Please help. We launched a pathetically tested vaccine onto the population, and our only reporting system was overbearing by the number of reports. We can't actually use the system. Please help. Or the expert at the FDA is working with the expert in the world, describing that our system isn't working, has a better system, but we don't like their answers. Please help. It would have saved a lot.
Good morning, CHD. It is Friday, May the 1st, 2026. We're live here at CHD TV, and I'm thrilled that we have Karl Jablonowski with us this morning, our senior scientist at Children's Health Defense. Good morning, Karl.
Good morning, Polly.
Well, I know on behalf of all our viewers, many of them tuned in live watching you at the Ron Johnson hearing. Just thank you. Thank you for standing up for us, for our children, for everything. It was fantastic, Karl. How was it?
Well, it was amazingly productive in one way, and I mean unproductive in another way. But you know, I'm just honored to have been there. Ron Johnson's team has done amazing work. They have a treasure trove of 10 million or more documents that they have and are continuing to sift through to find out the areas where we really need to hold people accountable. And this was one that was smack dab in the middle of that and has huge implications. And I know with recent, a few days ago, David Morenz was indicted. Honestly, he was indicted because he was the sloppiest of the bunch. It's not like we could just, check our little box saying accountability, done, moving on. No, there is a whole lot more accountability that needs to happen for us to, make sure that we don't repeat the mistakes that we've made.
And Karl, you had, it looked like there was quite a few senators standing up on your side.
Yes, I think maybe all but one of the Republican senators on that committee were present at any given time. And on the Democratic side, only Senator Blumenthal was there for some of it. I think another senator from New Hampshire popped in for just a moment, but I think left before it even started.
And do you think, by the way, viewers, shortly we're going to be showing you Claire Dooley was up there with Karl and she was filming exit interviews. So we've got some exclusive footage for you. So if you're wondering why Karl's not going to go too deep into it, he goes into it in a minute. But yeah, so we go and we do these things and you standing up for the science is just truly amazing. But I don't want to say what is the point because it's on record, which is fantastic. But is anything going to happen from us people speaking out, doing what we're doing? That sounds negative, I know, and I don't mean it to be.
I hear you. I already feel like most of this country just wants to march on and forget the last 5 years ever happened. And if we do, we're going to make those same mistakes again. And there are people who believe that the pandemic was all orchestrated. Even if you don't believe that, the last pandemic created 100 billionaires in this country alone, 1,000 billionaires in the world. Something that profitable is going to repeat early and often. And if we don't learn the lessons now, we're going to have to learn them later after a whole lot more people get hurt.
Yeah, and talking of people getting hurt, you did have a mother there, did you not? She was in the audience yesterday.
Yeah, so, Senator Blumenthal did not put up a defense remotely. I have a whole lot of respect for the witness he did call, but she could not speak to the issue at hand. In fact, Senator Ron Johnson said he doubted that Senator Blumenthal even read his report, which I don't disagree with. But in Senator Blumenthal's explanation of why things went down the way they did, he said that the COVID-19 vaccines were a path forward. And in this context of this hearing, that is an atrocious stance to take. It is very obvious, looking through the records, that there was a failure to warn. Even if they warned, a simple warning wouldn't be sufficient to ensure that the warning was actually considered, because you had the American Academy of Pediatrics, the AMA, the Infectious Disease Society of America, the ACOG, and the Trusted News Initiative slamming it down our throats that these vaccines were both safe and effective and necessary. So warning by itself was insufficient, but even that they managed to not do. And the person who I think of most when I talk about failure to warn is Victor Simoes. He probably never heard the word myocarditis in his entire life. After Israel handed the US slides on their myocarditis epidemic, after their Pfizer rollout, well after seemingly practically everyone at CDC and FDA knew about a risk of myocarditis and those vaccines, no one told us. And he was a victim of no one telling us. And he died 16 days after his Pfizer dose of myocarditis and pericarditis and an aortic dissection. And it's documented in the Biomedical Sciences and Clinical Research case report. So when I hear Senator Blumenthal say that this was a path forward, his parents also heard that, because they were sitting right behind me, and know that what he considers a path forward, for some of us, it was a dead end. It was just really hard to hear and sit through that. But he's made a few blunders in the very few words that he even spoke during that hearing. He talked about the acting director of CDC, Jay Bhattacharya, withholding the COVID-19 vaccine efficacy paper, the latest one, which we spoke to at length in one of our previous CHD TV interviews, where it really required a test negative design. And that was an absolute inappropriate design for this day and age, with the immunity as we have it. A test negative design is valid if both the vaccinated and unvaccinated are practically identical in absolutely every way, and they absolutely are not. I don't even know a single person who has gotten the latest COVID-19 booster dose.
I think we have another clip of you, Karl. Let's run that. Please, Lou.
By the time the CDC's webpage was updated to warn of inflammation of the heart, 313 million doses were administered to 173 million people. I do not see vigilance at work.
That's a great clip. Can you talk a little bit more about that? I mean, you just did a bit, but.
Yeah, so there were clear signs of myocarditis as a problem and a whole lot of other adverse events as a problem dating well back. Like even if you gave them the benefit of the doubt, you still have statistically significant signal dating all the way back to February when we can see signs of myocarditis. And the whole premise of the hearing was that there was a savior in the ranks of the FDA who identified that the EB data mining they were using to monitor VAERS wasn't working. And if you want to be a cynic about that, okay, well, that's one person with one opinion, but it's not. It's Dr. Anna Sarfman who is the reason why EB data mining even exists at the FDA. She's the one. Dr. William Dumichel published this terrific paper detailing how we could monitor large databases like this with a tool that he invented in 2003. In 2004, Dr. Anna Sarfman was the one who convinced FDA to adopt it. These two people got together and said it is inappropriate in the COVID-19 pandemic to use this software, which they invented. It's not just that they're saying it's inappropriate. They actually used a different software, which was appropriate, and emailed out reports to everyone who would listen at the FDA. And then the problem is no one was listening because no one wanted to hear it because it was just inconvenient. I described the COVID-19 vaccine rollout as a freight train going 100 miles per hour that nothing was going to stop. And it really looks like things were designed to not be able to stop it. VSafe collected data on inconsequential data that nobody cared about, and it wouldn't have stopped anything. VAERS, though it has the ability to detect signals, the CDC doesn't take it seriously. And we can see in the writing that when they write about it, we know they don't take it seriously because they talk about it as if it's just a collection of reporting biases. In fact, Dr. Tom Shimabukuro, quote, "It's not a database that should be used for serious surveillance or research." On that footing, nothing is stopping that COVID-19 vaccine train that is going to vaccinate the vast amount of the country, regardless of what these systems find.
Yeah, I think before we go, we've got to give a shout out to Senator Hawley. We have a tiny clip of him.
What we saw during COVID wasn't so much a public health campaign as it was a profit machine. A profit machine for the big pharma companies who made billions and billions of dollars off of a vaccine that they did not adequately test, about which they did not adequately disclose health risks. They made out like bandits, though. I mean, this is great for them. All of the public health problems get offloaded onto other people, namely the American people. All of the costs get borne by the patients. They don't have to do anything, and they get rich off of it.
It must have been great to have got that kind of level of support. I mean, as you're talking and then they're coming in, and it just must have felt great because we didn't get much support when we were up there.
It did feel pretty terrific. And there were a lot of people in the audience behind me who I could feel their support as well. And I mean, you asked what's next. And I think one of the things is we as a country need to come down really hard on FOIA evasion. FOIA is one of our main tools for holding our government accountable. And it is obvious throughout the documents that Senator Johnson has supplied that there is a very well-practiced machine of FOIA evasion. Things like these conversations aren't suitable for email is written in some of them. Some of them are like, we're going to stop this reporting system because of FOIAs. And it actually honestly looks like Children's Health Defense FOIAs have had an impact on what reports are being created at the CDC and how they are talking about them. And if we don't come down really hard on that, we're never going to be able to see the things that we need to see. And David Moran's being held accountable, at least on an indictment. Like I said, he was sloppy. There are plenty of people who are profiting off of the suffering of others and after doing a horrible job. Dr. Peter Marks and Dr. Cavazzoni are, represented in Ron Johnson's emails, talking about how they are ignoring and trying to stop Dr. Anna Sarfman from doing her job. From my opinion, the only person who is doing an adequate job of surveillance of VAERS. Peter Marks now has a 7-figure salary position at Eli Lilly, and Dr. Cavazzoni has a 7-figure salary at Pfizer. They're really teaching the next directors a path forward to make sure that they get a 7-figure salary right after they, get out of their position. And it is not looking like it's in the best interest of our health.
Yeah. So, okay. Let's just say to our viewers let's remind ourselves and our viewers that actually, as I know that many people are frustrated, myself included, that so many things haven't been done while Robert F. Kennedy Jr. has been health secretary, and I can't imagine the job he's going through. But think about it like this. We've never had a situation where our ex-boss is the health secretary. I mean, look at it like that. We've never had a situation where Children's Health Defense is testifying at hearings in Congress. We've never had that. We've never had a situation where so many of you are coming forward with your stories and we're able to air it. And this CHD TV is getting bigger and bigger and bigger every month because of you, the viewers. So when you look at it like that, we are beginning to win. But it doesn't help those that have lost children, lost people they love, all those hospital protocols no one's talking about those, Karl. We have to talk about those because millions were killed, murdered in hospital. So we do need to keep talking about COVID. And I don't know if you want to comment on that, but I just think good things are happening, but not good fast enough. And it's frustrating, but at least we're in this position. Could be worse.
I agree. When we stop talking about it is when we lose the ability to learn from it. And we really need to learn the hard lessons now, or we're going to have to do it later.
Yeah, well said. Well, Karl Jablonowski, thank you for being on so early this morning, and thank you for all that you're doing for us. It's very exciting. So we truly are grateful for you. And now we're going to play this exclusive for CHD TV, Children's Health Defense, interviews with Karl and Senator Ron Johnson, and I think maybe Dr. Wiseman as well. I haven't seen it yet. I'm going to watch it now. But thank you, Karl.
Thank you.
I am releasing an interim report titled, Unmasked, How Biden Health Officials Purposely Turned a Blind Eye Toward COVID-19 Vaccine, or I call them injection, injury safety signals. Documents we've retained, thanks to Secretary Kennedy's responsiveness to my subpoena and his commitment to radical transparency, paint a clear picture of an obvious cover-up by federal health officials.
We got to remember what it was like during the height of the COVID pandemic. Literally, the fear, the death, the loss, and then the relief as a result of Operation Warp Speed, which President Trump ordered, in having a vaccine that gave people hope. The vaccine offered a path forward for so many people, and we should be thankful for Operation Warp Speed.
When VAERS was reporting worldwide adverse events of 837,595 and 17,619 deaths.
Years of scientific analysis have shown that COVID-19 vaccines save lives.
In 2021, deaths spiked to 21,631.
Today's hearing purports to discuss a cover-up of side effects of the COVID-19 vaccine, as if serious flaws in vaccines were purposely ignored.
Dr. David Morans, now indicted for this, under conspiracy and destruction of records charges. He was an advisor to Anthony Fauci, emailed to colleagues on how to evade Freedom of Information requests. Quote, I learned from our FOIA lady here how to make emails disappear, and how he wanted, quote, correspondence on sensitive issues to be sent to me at my Gmail address, unquote.
The majority's report cherry picks emails and misconstrues an internal debate between scientists who were actively looking for ways to detect side effects.
Other federal officials appear to have openly acknowledged that they were actively attempting to avoid transparency. A CDC official discussing the sharing of vaccine safety data stated, quote, I think because of the FOIAs, we may have asked FDA to stop sending these weekly data mining outputs, unquote.
The report and documents that the majority has released simply do not support the notion of any kind of cover-up, nor do the reports and documents do anything to change our understandings of the vaccines as safe and effective.
7.7% sought medical care for COVID injection adverse events, and 25% lost time at work or couldn't perform their daily routine following injection.
Nothing that Chairman Johnson has released shows the vaccines were linked to any adverse effects beyond the rare ones that health officials have acknowledged. Indeed, the risk of stroke he claims was hidden not only was studied openly, but later shown not to exist.
Then my March 23rd, 2026 letter to Secretary Kennedy detailing the subcommittee's findings about masking and how federal health officials ignored and downplayed the risk of ischemic stroke following vaccination of Pfizer's COVID-19 bivalent booster.
We are fortunate to have with us Maria Young. Thank you for coming here today.
In 2020, I went from being a healthy, active woman with a full career to being sedated, paralyzed, and placed on life support within days. I spent more than 4 months in the hospital, most of it in the intensive care unit, ICU, most of it in a medically induced coma, and most of it alone. My mother was told repeatedly that I was not expected to survive. My sister wrote my eulogy. My family prepared themselves for the unimaginable, all without being able to see me in person. I stay up to date on my COVID boosters and other vaccinations. I also continue advocacy with organizations like Vaccinate Your Family to share my story through them, through my personal connections, and encourage everyone to continue to get vaccinated against COVID-19 and other diseases, in the hopes of helping people avoid the same traumatic experience I and my family went through, or worse.
Many of the things you said are exact same words I've heard from the COVID injection injured. These people were healthy, they were active, now they're permanently disabled. Our first witness is Dr. David Wiseman. From 1987 to 94, he worked at Johnson & Johnson, rising to the position of research fellow, leading a program that included pharmacovigilance. Dr. Wiseman has published in numerous top scientific journals, including the Journal of the American College of Surgeons. Dr. Wiseman.
With today's stunning revelations, I'm humbled to discuss critical flaws in statistical safety signal and potential risk detection in VAERS. Touted by CDC as the nation's early warning system for vaccine safety, and credited by former CBER Director Marks with detecting both potential and actual safety issues and informing vaccine policy decisions. Among limitations undermining detection of statistical safety signals is the problem of masking. Masking occurs when statistical signals for one vaccine in a database are obscured by reports associated with other vaccines. For example, Moderna's myocarditis signal becomes hidden if its comparison baseline is artificially inflated by including Pfizer's myocarditis signal reports. In a simple analogy, hemlock and arsenic appear equally toxic when compared separately with a non-toxic baseline control such as tea. FDA was obliged to consider, even without having to prove causality, and impugning vaccine injury compensation, authorization, and approval decisions, principle of which was Comirnaty's hastened full approval undertaken while Dr. Schaafman was voicing her concerns. Further, they marginalized those apparently injured by COVID vaccines. Not only did the system fail to perform as advertised, but as the drug safety paper presciently warned, the COVID vaccine reporting deluge likely created masking effects that now compromise signal detection for other vaccines going forward. And there are several papers that describe this.
Dr. Karl Jablonowski. Dr. Jablonowski is the Director of Science and Research at Children's Health Defense. He holds a master's degree in computer science from the University of Chicago and a Ph.D. in biomedical and health informatics from the University of Washington School of Medicine. His research focuses on bringing about an end to childhood health epidemics.
Pharmacovigilance is absolutely necessary. Our knowledge is limited, even of a vaccine that passes clinical trials of a few thousand very healthy people. We simply do not know what adverse events look like in a diverse, large population until they're administered to a diverse, large population. We had better be watching very closely, which is pharmacovigilance. The vaccines, by honest accounting, were pathetically tested. Pre-EUA, no drug-drug interaction study, no cardiovascular toxicity, central nervous system toxicity, other organ toxicity, blood toxicity, genotoxicity, carcinogenicity. One of the first papers to publish it was a mortality and adverse event study. The only figure in the entire paper was a time series comparison for both Moderna and Pfizer for both dose 1 and dose 2 of adverse events no one cares about. Injection site pain, fatigue, headache, myalgia, chills, and joint pain. The vSafe system had 10 million volunteers. About 1/3 entered free text. Perhaps there is some horror found in the 366 individuals who typed in myocarditis, a condition requiring medical diagnosis. That is amplified by the nearly 50,000 people who typed in chest pain. By the time the CDC's webpage was updated to warn of inflammation of the heart, 313 million doses were administered to 173 million people. I do not see vigilance at work. With VAERS, the CDC chose to ignore its own standard operating procedure and not run proportional reporting ratios in favor of the FDA's, what Walensky calls more robust and Shimabukuro calls the gold standard. VAERS had been grossly underreported for the first 30 years, maxing out at 58,000 reports. In its 31st year alone, VAERS logged 18 times that number. Because of this disproportionality, the FDA's disproportionality analysis was washed out. Since both vaccines were of the same platform and same adverse events, the comparison was muted. This isn't a blind spot. The FDA was completely blind to adverse events, and the CDC wasn't even looking.
Ms. Young, you've sat through all this stuff. If you had it to do over again, would you have gotten the vaccine?
Oh yeah, without question.
You would have gotten it, even knowing that there were potential adverse effects and side effects, which frankly there are with any kind of medicine these days. You still would have gotten the vaccine.
Yeah, and that's kind of how I think about it. Anything we take, medicine, vitamins, like everything comes with a risk. It was a measured risk at the time. And yeah, I don't regret my decision at all.
Thank you. Thank you, Mr. Chairman. And again, to Ms. Young, thank you for being here today.
Nobody that pushed these things wants to admit they are wrong. The advice they gave might have resulted in somebody's death or permanent disability. That's what we're faced with. That's why we have this massive vaccine injury and injection injury denying going on in this country. And I can tell you from my standpoint, I'm not giving up. I'm not caving to the vaccine deniers. I'm not caving to the ridicule and vilification. I think my next hearing on this will probably bring in the injection injured. Now that we have this report, and again, look at the timing of this. Peter Marks was made aware of this in March of 2021, the same time the NIH was treating people and they were admitting these people were injured by the COVID injection. They were promised that they would be studied, that would be made public, their injuries would be made public. And here we are, end of April 2026, that hasn't happened. I'm on a mission to make sure that happens. Well, again, first of all, I was not shocked, not surprised by what my staff found in the document production from Bobby Kennedy. And it's kind of been step by step. First myocarditis, then ischemic stroke in people over 65. But the real revelation was the fact that Peter Marks, senior FDA officials, were warned that the current analysis system of VAERS, which I think just VAERS in itself was screaming safety signals, right? You didn't need a fancy mathematical algorithm, but the one they used was going to mask the safety signals. And 26 days later, they did a run on a state-of-the-art system, new one that would unmask them, showing 49 cases of severe masking, 25 very serious adverse events that were showing a safety signal, including sudden cardiac death. So, I mean, the fact that they knew that and covered it up, and really when you look at the timeline, when the vaccine, the injection injured, were going to the NIH, they were being treated. So they were being acknowledged by people like Dr. Nath and people, and Dr. Marks knew about these guys. They're being treated. They're being told, okay, to be quiet. Don't tell anybody about this. But we're gonna study you. We're gonna release the findings of those studies so other people can get treatment. All the people in your groups will, these people are traveling. It's not easy to travel when you're severely vaccine injured. Come to Washington, D.C. to get treatment. But they did it for the science, to help the other people in their support group. And they just let them down the primrose path. And you saw the video where Peter Marks, even though we all know now that he knew that these safety signals were existing using an algorithm that unmasked the VAERS data, just continued to lie boldface up. I mean, we're just not seeing a safety signal. And then probably the most egregious lie was they said, well, we're going to make this public. Be quiet because let us announce this. Let us announce our study. So your support group, members of your support group can get treated. And that was all a big lie. To this day, they're continuing to lie. They continue to cover up. I just think it's outrageous. And this should, every American should be outraged by this. But unfortunately, you saw my ranking member saying, oh, you've cherry-picked quotes. You've completely distorted what the record is. We acknowledge vaccine injuries, but they're rare and mild. And there's, the cost is so minuscule compared to the benefit of all these millions of lives saved. And in part of the hearing, of course, I debunked the 3.2 million lives of the Commonwealth Fund. It's complete bunk. It's a fantasy to think that the COVID vaccine saved 3.2 million lives. You'd have to assume that our deaths went from 2.8 million to 5 million in 2022. Didn't happen. So again, we're up against people who have no problem lying. They have no problem lying to people that they're treating for vaccine injuries. That's the kind of people we're dealing with. They don't have a soul.
God bless Miss Weary Young for what happened to her. But at the same time, I kind of thought to myself during the hearing, this is the best that you have. You're sitting here with data. We know millions of people, we'll even just say thousands of people who have been injured and killed by just the vaccine itself. And you don't have anyone saying, no, that's not true with the clinical trials. The data is different. There's no one disputing the data.
So remember, I've been doing hearings and public events for many years now, right? I have frequently asked and invited the Peter Marks and the Anthony Fauci's to have a dialogue. This is open forum. I actually want to look at all sides of this. I don't know what absolute truth is here. So engage in the debate. The doctors, people like Dr. Wiseman, Dr. Jablonowski, it's too many syllables, okay? McCulloch and Malone and Pierre Corey. I mean, they would relish the ability to discuss and debate. They've never been given the opportunity, and that tells you something. What was the famous bet with Joe Rogan and Bobby Kennedy? What did that get up to, like $2 million for Peter Hotez? Was come and debate a lawyer, not a doctor, but a lawyer who has, as Aaron Siri talks about, I can't rely on my credentials. I need to rely on facts. And so Bobby Kennedy, Aaron Siri, quite honestly, my staff, we've got the facts on our side. So that's why the federal health officials, the experts on the other side won't come to our forums. They won't discuss this. They won't debate it. You'll notice we only had one Democrat, Richard Blumenthal. He had no facts. He just had criticism that we somehow, in this highly detailed report that makes the cover-up obvious, saying, we were cherry-picking quotes and we were distorting the reality of the situation. So, no, they've got nothing, and so they can't produce anything. But I thought it was very interesting that the Democrat witness used the exact same terms as Bree Dressen and the vaccinators. They just want to be seen, heard. The vaccinators want to be believed so they can be treated. And their witness was healthy and active. That's what all the vaccine injured were too. You would think there'd be sympathy, and so we'll connect them. I appreciate the fact that their witness is willing to be connected with the injection injured as well.
As you've said, you've held many pairings of these sorts. Is there, I guess, obviously, as you've said, it's common sense to care about this. It's common sense, but you don't see any other senators doing what you're doing. Is there a personal reason? Or
well, have you seen how I've been vilified and ridiculed? No, it's interesting. If you read Bree Dressen's book, Worth a Shot, and I didn't know this till I read the book, but they're describing when Ken Ruckers, whose wife was vaccine injured, Green Bay Packer player, lives in Oregon, not a Wisconsin constituent, he contacted me. He's trying to contact all other, a lot of other members of Congress, right? Nobody else would talk to him. I would. And because of the way I've been treated in the media, falsely treated in the media, the injection injured, they had nobody else who was willing to listen to him. They were appalled that I was the only guy. We had our first Zoom meeting. They literally had a safe word that if this thing was going off the rail, they could end So I think it's pretty funny. It's a good book. It's a very good book. I mean, you really get a sense of how severely vaccine injured Bree was, and so many people in her support group. I mean, these are life-threatening, almost life-ending, and some of them were so severe, the people in the support groups took their lives. Bree wrote in one of our events, read a letter she got from somebody when they shut down when Facebook shut down the support groups. People had nobody to turn to, and a number of them committed suicide because of that. That's on Facebook.
The next question would be, how do you see this moving forward? What do you want to see happen?
Well, again, what I've been doing literally since 2020 is I've just been laying the foundational base of information, fact, truth, kind of one brick at a time to provide the information of foundation that's irrefutable, that people start accepting what the truth is here. Because that's part of the vast majority of Americans just want to move on. They don't want to believe that maybe something they agreed to take might have long-term consequences for them. They just want to forget it and move on. And of course, the people that pushed it, that recommended it, that mandated it, they don't want to admit they're wrong either. So that's the biggest problem we've got is the basic human tendency is nobody wants to admit they were wrong. And I mean, there's severe liability for those who push it and were in responsible positions to survey, keep track of our safety surveillance system to warn the American public so that people were fully informed as to whether or not, based on their risk factor, whether they should really take a shot at, take a risk of taking this experimental injection.
Okay, one side, yeah. 1, 2, 3.
How do you feel, what's your initial reaction coming out? Do you think that, did Blumenthal actually receive the information you were giving him?
Well, I didn't really know what to expect. I didn't know how many on the Democrat side would show up, and he was the only one. I think there was another person that sat in for a moment, but he was the only one that showed up. He left a couple of times to go to other votes or something that he had to do. But he really didn't ask us any questions, myself or Karl. His comments were really directed at their witness, who had an important story to tell about her experiences, suffering from COVID and so on. But it was a counterpoint to the sort of scientific, and no one was arguing with her experiences, and no one was arguing with her suffering and so on. I think everyone empathized as they should do. But we're here to discuss some serious scientific issues. Those really weren't debated. It was aired in the form of the majority witnesses being asked a series of questions, which I hope we answered reasonably well. But I think the most important story of the day was the release of the report by the majority team, the senator and his amazing team that did a really bang-up job at putting this together and finding these important findings that the FDA knew about the deficiencies in their empirical Bayesian data mining. They were told it by some very important and significant people, what I termed the mother and father of the original method, who are now saying, our original method was good, but it has limitations, big limitations. We're astonished that you're finding anything. You should be using the new and improved method, which is not all that new anyway, but the FDA just refused to do it. So I think that's really the important story, and I hope that the senators are going to be able to run with it and do whatever it takes to come next. I have no idea whether Senator Blumenthal denies or what he has to say on vaccine injuries. I'm sure if he was faced in a hearing of the similar kind where there would be someone from the React 19 group, for example, giving a very compelling and important story, I don't think he would deny it. And Peter Marks, for that matter, didn't deny it. I mean, in the videos that we saw, in the clip that the senator showed, and other clips that are available online, outwardly, the FDA officials are saying nice things in a nice way, and they're trying to be, very empathetic to the suffering of the people. But then the big lie is that they knew all along, while they're telling the React 19 people, we don't see signals for this, we don't see signals for that. One of the comments from Dr. Nair was that the Peter Marks gave him instructions to leave no stone unturned. And he's saying this with the knowledge that they know their stones aren't capable of being overturned. So that's a really, those are really the shocking things. Another aspect before we get to your second question is that, there was some evidence in the documents that we've seen where they're saying, well, we shouldn't really discuss this, on email and that sort of thing. And the senator was sort of making an analogy to the Morans case that he's been indicted for, concealing information and so on. So while there may be some evidence of that, the more shocking thing is that what was in the emails and the fact that the federal officials didn't seem to think it was even a problem for them to be writing openly, oh, we need to tell Anna Sharfman to cease and desist. That's even more shocking. So anyway, so that's on that part. Now you asked me about the manufacturing issues. That's a hugely important issue. And the purpose of the meeting today was not to discuss that, although I got asked some questions. And you said, did they do it on purpose? Well, I think Moderna was always using that similar equivalent to Pfizer's process too. They were always using that process, and they didn't change. Pfizer maybe were a bit behind in that regard, so they just used the first thing they could do to get the clinical trials going, which was to use a different process to make the mRNA, called a PCR process, in order to get the clinical trial done. And then, while that was being done, then they said, okay, now we're going to switch to the other process that allows us to make vast quantities of it. And the question was asked by one of the senators, sort of directed at Pfizer and Moderna and sort of saying, well, they're responsible for this. So yes, they are responsible for this, but in large part, they did this with the full knowledge and even perhaps collaboration or whatever other word you want to use of the federal government. They weren't hiding that part of it. So it's difficult in this circumstance to dissect exactly the culpability. I made the point that the drug company still has a moral obligation to do certain things, but if the FDA says, okay, you only need to do X, Y, Z, the companies, that's all they're going to do. That really has to be dissected out, and that's a huge problem. But in the one case that we know for Pfizer, where they had this specific sequence that they put into the process 2, called the SV40 enhancer promoter sequence, they did not disclose that, and that's publicly acknowledged in FOIA and other kinds of documents from the United States and Canada, other places, that they chose not to disclose those things. So despite them having a sweetheart of a deal, despite them having all sorts of immunity under the PrEP Act, okay, I think that's a gross abuse of the public trust. And the point was made, yes, they made billions and billions of dollars. That's a really big problem. For a lot of us that have been in this story for, nearly 6 years in the COVID story, the vaccine sort of 5 years, I think we really want some reform, major reforms within the FDA and the CDC, how they conduct themselves in all sorts of ways. There has to be some leadership from the top about how science is conducted too. This othering of scientists and doctors and patients, that has to change. But with regard to the COVID vaccines, I think they've had their time. And we've learned what other approaches there could be. The hydroxychloroquine story, which I was able to bring up in this hearing, I think we have to go back to. And the tragedy of hearing this Ms. Young telling her story, for me, was knowing, and I told her afterwards, was knowing that I had data that I was not allowed to, I was prevented from publishing in the right places, that perhaps could have meant that she would never have been in the situation that she was. So I think we have to look at all those. But I want some real big reforms from Secretary Kennedy. I want some major research as to what the long-term harms are of these vaccines, and how they affect other vaccines, mRNA vaccines, and also how this whole VAERS has been corrupted. That's going to affect the safety monitoring of all vaccines. That's a huge problem.
What was your initial reaction seeing Maria Young there among you guys? And basically the interaction with Blumenthal versus the kind of data and science that you were talking about with Wiseman.
Right. Well, there was definitely a disparity there. I unfortunately took her presence there as a sign of no contest by Senator Blumenthal. He was not there to examine the facts of the hearing. He did not ask either Dr. Wiseman or myself any questions. So he primarily engaged in the sad stories that came out of afflictions from COVID, the virus, not the vaccine. He did tout that the vaccine was, I believe he said, a path forward. But that was his stance and his footing going into this hearing, which speaks of nothing of the report that was generated or the many pages that were released implicating the CDC and the FDA really dropping the ball. And I mean, not just negligence. I honestly, it goes beyond negligence, what they did. They specifically ignored really good evidence of harm. I hope that this is a good sign that the investigations will continue and that we will get to the bottom of this very deep pit of malfeasance. This comes the day after David Morenz was indicted. David Morenz was indicted because he was sloppy, because he wrote emails talking about deleting emails and covering things up. There is clear evidence of FOIA evasion in the documents that Ron Johnson released. And obviously, they were not found by a FOIA. They were found by the senator releasing documents, mostly unredacted documents.
Anecdotes are powerful, and can be powerful. And I don't think that anything we talked about today, you talked about, and Wiseman talked about, takes away from her experience. She can experience that, that's fine. But that also doesn't change the fact that many people have been injured and killed by the vaccines themselves. I just find it interesting that she was the only person that they could bring as their witness, that there wasn't someone who was a scientist or, you know, similar to your background and Wiseman's background.
Right. On anecdotes, you know, as Senator Blumenthal was sitting there talking about that vaccines were the way forward, and that, you know, tried to say that we did the best that we could at the time, we didn't. I almost mentioned, if he asked me any question, I would have started with Victor Samoas, who died 16 days after the second Pfizer dose, May 6th. That was well after CDC and the FDA knew of a myocarditis risk and well before they told anyone. His parents were sitting behind me, which I was unaware of at the time. As to, you know, a scientist that could speak to the data, the documents presented are just so damning. You couldn't find a person to speak to that data. There's no question that VAERS was designed for inconsequential data, that VSafe was designed for inconsequential data. There's no question that the CDC and the FDA dropped the ball, were absent in what would be their finest hour. So one really important revelation that was in Senator Ron Johnson's documents was the email exchanges between the CDC and the FDA and Dr. Judith Morrow of Harvard. They were working on a tinnitus paper, and Dr. Judith Morrow actually said it would be mostly useless to say anything about COVID-19 vaccines because you can't create a comparator of the broken system that we're all relying on for pharmacovigilance. So in response to the documents reveal, Dr. Brian Hucker and myself actually wrote a letter to the editor of the journal that published that paper, suggesting that it was meritorious for review, for retraction, either in part or in whole. That editor actually sent it out to review, which is one step closer, and I think the closest the CDC and FDA vaccine paper has ever been to being retracted. And this is all made possible by the hard work of Children's Health Defense. I hope that we begin to learn the really hard lessons that we need to, because if we don't, it's going to happen again. Even if you don't believe that the last pandemic was orchestrated, it created 100 billionaires in this country and 1,000 billionaires in this world. It's just too profitable to not try again. And I hear a lot of questions about how can we gain confidence so that American trust public health institutions again. And my response to that is, why would you want to? You trust an institution when you feel powerless over it. I don't want Americans to feel powerless over their public health. I want Americans to be empowered over their own health and empowered over their own public health. Yep. Carl Sagan was a big proponent of science and science being a self-correcting mechanism, and he was an optimist, and yet he lived through big tobacco science. And of the many thousands of people who died believing in big tobacco science, he said, gullibility kills. That is brutal and honest. Trust does not belong in the same sentence as any public health institution. It doesn't belong in the same sentence as government. It doesn't belong in the same sentence even as science. You approach it as you would any other thing in your life. You find the smartest people you know with the biggest hearts, the smallest ego, have nothing to profit from your decisions, and are really big on integrity. You ask them, a dozen of them, what they would do. Have a discussion. Whatever it is, that formula is not going to lead you to the American Academy of Pediatrics. It's not going to lead you to the White House or the HHS or the CDC. It might, depending on your perspective, lead you to Children's Health Defense, where we work really hard, actively participating in the correction of science, so that when this period of time is written about, no one uses the word gullibility.
I'm Dennis McGee.
And this is about a friend of yours.
My friend Daniel Freeman.
Okay, so did Daniel take the COVID shot?
I don't know. I think he did. A lot of our group did. I benefited. I watched David Icke, the Dot Connector, early in 20, and I knew it was a sham. I knew it was a scam. He pointed out there was no excess death in 20. We were having a flu season. I knew that. I tried to tell everybody that I knew that the shots were poison. They were liquid cancer.
But you don't know his medical history, so you don't know if he took it or he didn't.
I do not.
Right, okay, so let's leave it at that then. So what made him go to hospital?
He got COVID. He brought his family on a cruise. When he got back, he had COVID. They went to the hospital. They put him on a ventilator. They took him off the ventilator. They transferred him to another hospital. They put him back on the ventilator. This went on for days. And he finally succumbed on August 7 of 20. We didn't get to talk to him. We didn't get to see him. We had just back and forth communications with his family and members of our group.
So why do you think they killed him?
Say again?
Why do you think they killed him?
For the same reason they killed 800,000 others. They wanted to sell that product. They sold a bunch of it. No, it was medical murder. I am a Vietnam era Army medic. I got trained I have some knowledge of medicine. I went on to train as a mobile intensive care paramedic. I've helped put people on ventilators. In the Army, I served in maternal child health care section at Madigan Army Medical Center at Tacoma, Washington. We're a 1,100 bed hospital. We had 3 neurosurgeons in the house all the time. I started out in Well Child Clinic, went to pediatrics, went to normal newborn nursery, the OBGYN clinic, and ended up in the neonatal intensive care nursery at Madigan. In '75, we were one of 3 neonatal intensive care nurseries on the West Coast. All of our patients were on ventilators because they didn't live long enough in utero to develop the ability to breathe. We're very familiar with ventilators. In pre-hospital emergency medicine, ventilators are contraindicated unless there's trauma. Of course, in heart attacks, when people stop breathing, we have to put them on a ventilator. It's a very violent process, period. My wife has had major surgeries, and of course, they reduce you to near death, and we have to breathe for you while that's going on. That's normal, that's routine. Very specialized people, highly trained, do this well, routinely. It is contraindicated in people with just respiratory problems. They killed people like that. Pressures were increased too high. We know this. They killed Daniel. There was no reason in the world to put that man on a ventilator. Just like the other 800 some odd thousand they murdered him. I knew it when it happened because I have Some knowledge of medicine is contraindicated, period. Anthony Fauci and the NIH came out with these protocols specifically to kill people. I've got a message for them. We're coming for them. It's happening. This is part of it. This is the general part. The best they can possibly do is call up those judges they corrupted, bribed, badgered into violating their oaths and beg for protective custody. We're coming. They're criminals. They know it. We know it. They know we know it. We're coming for them.
Why do you think they killed so many with these ventilators? Because as you sit in here, this is our memorial, and most of the people in here have been killed the same way as your friend. What's it about?
It's about total control. There is a class of, call them the elites, I call them the E-lights, because they're light of mentality. I can't conceive of them as wholly human. This is so inhuman, is the best word I can come up for with it. They want total control. They want to live forever. They think they can engineer that. They're wrong. I got news for them. Everything that lives dies. This is our reality in our existence. When we die, they're controlling that with millions of people now, and obviously have no right to do that. They think us useless eaters. They're wrong. They think us stupid, ignorant, useless eaters. They're wrong. Ignorance can be fixed. I'm overcoming my own personal ignorance. I wasn't involved. I was among, for years and years and years, and I'm ashamed to say this, but it's true, I was among the apathetic, the great unwashed, if you will. I just didn't care. I was living my life. I was trusting government to do its damn job. They've stopped doing that now. I don't know who bought them. They want total control. They want to live forever. They think we're useless. They're wrong. The ignorance is being overcome rapidly. You folks are a wonderful part of that. I'm so grateful for you. I really, really am. I've seen you on the net several times. It's wonderful to get to see you in person, and thank you so much for doing this.
Well, so we've interviewed a lot of people who have talked about their loved ones. They've got the medical records and they've gone through it after they've been killed, like your friend. And all of them are given those paralytic drugs, so they can't, and they're struggling. They're put in 4-point restraints, and then they're vented. That's
yes,
barbaric.
It is barbaric. One of my younger brothers had bypass surgeries in 21. I went to see him at St. Thomas Hospital in Nashville. He was fully conscious with a vent tube in him, and he was restrained. He was crying. He was struggling. He was hurting. It was grotesque. I didn't pull the tube because I was afraid they would kill him when I left the room. I didn't cut him loose so he could do it. And I cried my way back home. And I know to this moment, we're coming for those people too. There are records. I don't know what kind of insanity. I can't explain it. They think we don't know. They're wrong. It's all so public. Our system is bastardized and warped now and mutated till it's almost unrecognizable. That's going to change. It is changing as I speak, as we speak. This is part of it. I'd rather be at home working in my shop. I came over here 2+ hours to tell this to the whole world, okay? It's got to stop. It will stop. It will stop. It's inevitable. There's a pendulum swinging in reality, in existence. It's coming back this way. It went that way for a long time. It's coming back. And it will come back with a roar. The best hope for the people who have done this is to get in the system. In America, they have rights. They've abused privileges, but they have the right to claim sanctuary within our system, and that's their very best bet. If the owners kill Bobby Kennedy or Donald Trump or Joe Biden to start a war, they're not going to like the result because a lot of us know who our enemy is. We'll go to D.C. and get the criminals that have done this. We're not going to fight each other. They want to program me to hate one of my best friends, as black as the ace of spades is his t-shirt. They want me to hate him. Not happening, come on. Not happening. They want a race war. They're not going to get it. Because so many of us understand who our enemy is. And our enemy are the owners who have corrupted this system. We're going to go right to the top. I saw a guy on X last night talking to Alex Jones, a former Green Beret. He's saying they have a list. What are these creatures? They think we don't know. They think we're all stupid and ignorant, and they're wrong. They're public figures. Anthony Fauci, where are you going to go, bud? When this becomes public knowledge, when the consensus crystallizes, we're going to go get them. Their very best bet is go to the government now, call the corrupt judge, and claim sanctuary. Because there's millions of us out here who have been offered no quarter and who will give no quarter. If our system fails, and they make we the people do this, they're not going to like the result, because it's not going to be pretty, and it's going to be very fast. If they, the owners, kill one of these three men to start a war, we're going right for them. I'm not fighting my neighbors. I'm not fighting anybody because of their skin color. I know who's done this. They're all public figures. We know where they live. In Tennessee, we have the Tennessee Citizens for State Sovereignty, who are bringing legislation in our state capital to enable us to nullify federal overreach, to nullify all this criminality that they're shoving on us. They really think in D.C., all those people who signed the PrEP Act believe they've gotten away with it. Wrong. No, they haven't. This is being addressed, will be addressed in Tennessee. We'll nullify that so we can sue pharma. They think pharma's protected. Wrong. None of that legislation is constitutional. It will not stand the test of time. We will bring them to court. We will win. Texas is already doing it. I love it. We'll do it here too. When the ball starts rolling, it will snowball unimaginably and unimaginably quickly. The dike is failing. It's failing. I love it. I want to see it happen.
You're a very good friend to Daniel. Thank you for telling his story and the barbaric way he was killed. Thank you for doing that. And we're going to remember him. We're going to get a photograph. We're going to put him up here in that thing. People remember, this is his views, not necessarily the views of Children's Health Defence, because we all know everybody wants to take down Children's Health Defence.
No, yeah, no.
So we have this disclaimer that we put out. We all know what that means.
Oh yeah, let me say it. This is Denny speaking for Denny and millions of other Americans, but not Children's Health Defense. This is my opinion. These are my views. It's going to happen. We're coming for you, bud. We're coming for you. You better go in the system, because you won't like it if we have to do it.
Thank you for telling your story. Thank you for your opinion. Thank you for driving so far to be here and sitting here and telling us this.
You're very welcome.
This and all CHD TV programming is made possible by generous support from viewers like you. Please consider making a contribution today to keep our programming going strong. Thank you.